Alcohol use disorder, what are the symptoms and when do we realize?
He has problem in his professional area, family, society, everywhere. Harmful use, abuse, addiction and dependence.
Are there therapies for this? Is there a treatment for this? How does the family help?
Some problems like tremor, restlessness, sleeplessness, irritability, unsteady gait.
What is the facility do we have for rehabilitation center?
We don't have facility for psychiatric inpatient treatments.
But psychiatric hospitals are admitting them?
Yeah. This is someone told me, sir, मेरा तो अस्थि के साथ जाएगा because I'll die with my alcoholism.
Namaskar. Welcome to yet another episode of Kalinga Med Talk. My name is Nilanjana Mukherjee. I am the Managing Director of Kalinga Hospital Limited. Today, we've come up with a very interesting topic, which is a social problem today. And I'm very, very happy and delighted to introduce that there is a very senior doctor who's a very eminent psychiatrist, Dr. 𝗞𝗹𝗶𝗧𝗹𝗀, who is working with Kalinga Hospital for years today. And we are going to speak about alcohol use disorder. I would request Dr. 𝗞𝗶𝗧𝗹𝗀 to introduce himself about his work to our viewers. Sir, could you please introduce yourself?
I am Dr. 𝗞𝗶𝗧𝗹𝗀, working as a psychiatrist in Kalinga Hospital for last 7 years. I did my post-graduation from Central Institute of Psychiatry, Ranchi, which is one of the pioneering psychiatry institutes of India. I worked for 35 years in Coal India, and unfortunately or fortunately, alcohol use disorder is one of the major problems in coal industry. The harsh working conditions, the remote areas, and away most of the families, I think lured them to the lure of alcohol, and it is one of the major problems we had to face during our career as a doctor in Coal India Limited. And that led me to the interest in addiction medicine. Here, working in Kalinga Hospital for last 7 years, I have also come across a lot of alcohol use disorder cases. And I would like to share with you that our result with de-addiction program has been relatively successful and encouraging.
So to further continue with this topic, sir, alcohol use disorder. So as it said, alcohol use disorder is, as it is very clear that here we are talking about somebody who's got used to alcohol. So sir, can you please tell our viewers that when do we realize that we are dependent on alcohol? What are the symptoms and when do we realize that?
Actually, ma'am, alcohol use disorder is an umbrella term for all the problems that an alcoholic person is going through. Alcoholism and all that has become very pejorative denominations. That's why alcohol use disorder encompasses all the terms like harmful use, abuse, addiction and dependence in different grades. Now, dependence is the severest form. And the minimalistic one is the abuse. Now, having said so, it is not very difficult for a person to make out that he is having some disorder. Now, what is disorder? Disorder is the condition, a behavioral problem in a person when he is not able to function properly in the society. He has problem in his professional area, family, society, everywhere. So, alcohol use disorder, to sum up, is the problems one faces when one have alcohol in more than the usual amount. Means, as you know, madam, alcohol and tobacco are the two substances that are licit. They are not illicit because they are not banned by the government.
Right.
The others are illicit drugs like cannabis, opioid and all that. Now, out of all this, because of the the confusion in the term and overriding criteria, now we have got this alcohol use disorder. The severest form is dependence. Dependence has got some hallmarks. The first one is tolerance. Tolerance is the person requires much more amount of alcohol to get the same kick, or the same amount gives him a less amount of kick.
Okay.
Second is the withdrawal. By any chance or any reason, if there is reduction or stoppage of alcohol intake, patient goes through some problems like tremor, restlessness, sleeplessness, irritability, unsteady gait. They may have also seizures. So this is the withdrawal symptoms. The other one is the person is whole time is spent on acquiring alcohol, leaving aside other things which he is supposed to do. The other criteria is knowing fully well that he is having problem due to alcohol, he goes on taking that. And last but not the least is craving. The craving is important in the sense, in the maintenance phase of alcohol de-addiction, patients get craving all through, but it is the physician whose primary aim should be stop craving. Now craving has got another aspect, that is cue-driven craving. Means the person with whom he was taking, the place where he was taking, the time where he was taking, those act as cues. So these are all the part of the hallmark of dependence. That means the person has become severely dependent.
Okay.
Now another way which the patient can know himself is a small questionnaire that is called CAGE questionnaire, CAGE.
CAGE, okay.
CAGE questionnaire. It is a self-administered questionnaire. It is not a very reliable, but it gives a rough guide. Means first is C. Have you ever thought of cutting down on your alcohol consumption?
So cutting down.
You have to think that. Second, have you been annoyed by the people around you telling you about your alcohol habit?
So being annoyed, yeah.
Being annoyed by them. G is, have you ever felt guilty about your alcohol use disorder? Means alcohol intake. And last is E. E is eye opener. Is it that the first thing you thought of after getting from bed is to have a peg of alcohol?
Alcohol or not.
So this is eye opener. So either of the two or more than two is positive, then it's time for you to go to
A doctor.
Dr. Chakravarti.
So very well, sir, you explained to us. Now, my question to you is for the viewers also, that you said that there is something called an accepted amount. And what you told about CAGE, CAGE, is where you analyze yourself that, today I am dependent on alcohol. And you also mentioned that there are these environmental conditions also, which you as a doctor also evaluate that. Now at today's day and age, what do you think, sir, is the maximum reason of a lot of youngsters depending on alcohol? Because what the social norms is, when we were young, sir, when you were young, when I was young, getting alcohol was not so easy. Today it is at your doorstep. And today this generation, I don't think they can have a party where they don't have alcohol. Whenever we talk about party, I would say that customs, traditions, weddings, everywhere alcohol is flowing, sir. So being a doctor, what do you think has been the social change which is bringing in so much of disorder, sir?
Well said, it is a nice question, because as you rightly pointed out, alcohol problem is very much in our society and a lot of factors come into play. The first is, if you analyze the alcohol use disorder, usually it starts in the teens as a fun, as something for an excitement or to get a new experience. Gradually that goes up. By the early 20s and late 30s, this becomes a habit if he doesn't stop there and the other things come into play.
Okay.
Like he gets married, he has a family, he has children, he has a job, and if there are problems like stress, modern day stress is too much, and most of the people think that one of the ways to get out of stress is to go for alcohol. And the problem is alcohol, which started as something fun, as a fun, or to get out and to share with your friends, comes to a stage where if you try also, you cannot get out of it.
Yes.
Because by that time, the biological functions in our body take over. The neurotransmitters take over. The biochemical things take over. So that if at all I try, I cannot get out. The problem is, if he cuts down or he stops, he gets withdrawal symptoms.
Yes.
And the easiest way of to get out of withdrawal symptom is to have some alcohol. So he thinks he is in a typical vicious circle.
So if he doesn't have this, he gets this, so he goes back to this. Okay.
The problem is that most of the people try it that way. And in repeated failures, if he is sincere enough, he comes. So people do it for fun, peer pressure,
Yes, tremendous.
people having psychiatry problem, people who want to get out or face some stressful situation in life, and some people just like those who are other substances other than alcohol. Alcohol is also one of them, is those sadhus, yogis, something very super being to have an ecstatic feeling, they do go to it. But as I've already pointed out, by the time they want to get out of it, they are in a real biological trap.
Yes.
Yeah.
So, sir, one thing I would like to know is that, so why do people drink alcohol? What you stated is very correctly. Some do it for fun, some do it to get rid of their depression. As a psychiatrist, sir, can you please enlighten us that what is the psychological effect if you have alcohol? Do you get out of depression, or does it make you more depressed? What is the mindset? What is the exact mindset when you have alcohol?
Actually, alcohol in the short run gives you a feeling of ecstasy, because
Short run.
basically it is a cerebral depressant.
Okay.
So it releases the brain all the negative feelings, but in the long run it causes problem. It causes all sorts of problems, like alcoholic intoxication is one of the problem, and any type of psychiatric problem can be associated with alcohol use disorder. Most common are anxiety disorders, depression, and in some people in Indian context they may have also schizophrenia-like symptoms. But the commonest are the depression and anxiety. The trap is the problem from which they want to come out.
They are getting into it.
They are getting into it.
Okay, so you mean to say alcohol is just going to aggravate your anxiety and depression even more?
It's for the time being.
For the time being.
For the time being. But in the long run, it gives rise to sexual problem. It increases your desire but takes away the efficacy. So people get disheartened.
That is a more frustrating part of it.
Yeah, that is one frustrating part of it. And other things that come into the play is that alcohol is not only bad for the person, his physical, mental and other things, his family.
Yes, that's a very important thing.
That's what I've seen. Most of the wives of the alcoholic persons are very depressed.
Absolutely, absolutely.
They are anxious. They have a financial problem because the salary that they get, half or more than that is consumed in alcohol.
Yes.
And one important thing, if the person who takes it regularly doesn't get alcohol, he tries to get it by hook or crook. He sells off the family property.
Yes, that becomes.
He sells off the last jewelry that the lady had, and in some cases they do crime.
They go back to that level. It really doesn't bother them how the family is staying, but alcohol becomes his priority.
Because they are already in the vicious circle. They can't get out of the trap because the biological changes has already occurred.
Yes. And the children also suffer with that.
Children will suffer more than that.
So you get cases where the family has come to you for therapies and how they want the therapies to be done. So how, in turn, my question to you, sir, is that how do we get out of this now? Are there therapies for this? Is there a treatment for this? How does the family help?
Here I will thank you for asking this question, because most of the people that come to me, they are having a notion that an alcoholic is always alcoholic. जैसे someone told me, sir, मेरा तो नशा मेरा अस्थि के साथ जाएगा, अर्थी के साथ जाएगा, because I'll die with my alcoholism. That's not correct. When I was in Coal India, I wrote a book in Hindi.
Okay.
शराब एक धीमा जहर. It was distributed to all the things with some photographs, and it was in Hindi. There I have written about some of the myths that was prevalent at that time. I was in Jharkhand, and in 50 years of India's independence, we made a program.
Okay.
We visited all the collieries in Jharkhand under Central Coalfields Limited. At that time, there was no slides, and we had that overhead projectors. With the overhead projectors, we went to almost all the collieries, and we talked to the cross section of the people. The common myths are that English mal acha hai. IMFL is better than country liquor. Country liquor is freely available. It is better that if you get a good meal with food. Of course, absorption of alcohol is delayed if you have
full stomach.
Full stomach, and if you have a carbonated drink like soda. Now, another important thing is that there is no treatment, but it's a mistake. Treatment means there is not a cure. What we do? There are two things. As they say, hit the iron when it is hot. The patient usually comes to the hospital for some other reason. And if you get a history, that's why I ask all my colleagues to get alcoholic history. Because they have tried and failed, most of them are having a negative idea about alcoholism. So, the first line of treatment is a motivational interview.
Okay.
Because motivation is the thing that will drive him and us
to go towards a better future. Yes.
For that, you have to take a full history. And in alcoholics, the full history involves the person who usually says much less than what he takes. We take from the spouse or friends. And after taking, how much he is taking, how frequently taking, what type of drink he is taking, we make a motivational interview program. Give him the options. If you are taking alcohol, alcohol can cause this. Alcohol is a thing that is a direct toxic to all the tissues in the body.
Okay.
From the brain to the toes. Every tissue has got direct toxic to the brain. Your liver, your heart, your pancreas, your stomach, your brain, everything is affected. And last but not the least, some of the common cancers like throat cancer, breast cancer, lung cancer, liver cancer is very common in alcoholic people. Tell them, don't frighten him. Tell them this may happen. Total assessment is done. Then we go for a program. Now, there are two things. Either you have to stop it altogether or you have to cut down. Most of the people are having the idea that you can't go for a total stoppage. Sir, पूरा बंद करने से कैसे होगा? But it is better that if he agrees for total stop it. Because the problem is that, just like that 𝗞𝗹𝗶𝗴, once he starts taking, he will go on taking.
Yes.
There are two phases of it. One is withdrawal phase. Take care of the withdrawal symptoms, what we usually do, so that he can think that he will stop alcohol, will substitute with medicines.
So you take the withdrawal symptoms through medicines, take care of it through medicines.
Yeah.
Okay.
And it is for the last 15 days. If he can realize that I can stay sober and have my sleep, I am feeling good, I am having all my biological functions like sleep, appetite, everything is normal, so I can live without alcohol. Second is maintenance phase. That is important.
How long can you live?
Yeah. Maintenance phase is important in that the first 1 year is very important and 6 months is all the more important of relapse. And the problem is that, just I told you, once relapse occurs, it becomes difficult. So what we do in relapse period, we give him anti-craving drugs.
Okay.
They are not foolproof, to be very frank enough, but properly given along with psychological counseling
is effective.
Particularly CBT. We are not going for a structured CBT. What we do is we talk common sense. And the most important part, it is not a one-off phenomenon. The person and his family, particularly the spouse, should come regularly, follow the instruction, we will be in contact with the caregiver or the doctor and inform him if there is any problem.
Okay.
Now, yesterday one person came. He is a BTech engineer working in one of the multinational companies. He was having all the habits. Now he has cut down everything, he has come, and now he is only taking ganja. He came, he was crying. What is the problem? He has stopped ganja for 5 days. Now he has come with the problem, the withdrawal has become multiplied. Because initially he told, sir, I can't live without any of the things. Means either of the things I should have. Means he was taking 3 to 4 drugs. I must have one. I told no, you give up everything. You have got a wife, you have got a small kid, you have got a steady job. Now if you don't stop it. So he told me, sir, you told me to leave, I left it, but I am having a hell of a problem. Hell of a problem. He was very anxious, he cried and all that. I told him nothing doing. You take it, you come after 5 days. I am happy to say he came yesterday with his wife. The first thing, he came and started, I know, nothing doing. What is the, I'm okay now. So, regular contact with the physician is very important. Continue the drug at least for 1 year. And these anti-craving drugs should be continued minimum 6 months. Then again, according to the patient's wishes. The role of the family is very important.
So, sir, in Bhubaneswar, in Odisha, what is the facility do we have for rehabilitation center and Alcoholic Anonymous, or do we have such some centers
I don't
like
know about Alcoholic Anonymous. There are few centers, but I'm not very aware of it. Now, yesterday only it came out in the paper, the government is already some de-addiction center.
Yes.
And the Chief Minister has told that they are going to establish much more de-addiction centers in the state.
So, state-of-the-art de-addiction center actually is not there. So, typically these patients who need treatment, do you admit them in a hospital?
No. We don't have facility for psychiatric inpatient treatments.
But psychiatric hospitals are admitting them?
Yeah. Yeah. But the thing is that most of these things de-addiction can be done in OPD basis.
Oh, okay.
Unless they are taking it for a long time, in large amount and very frequently.
And they are violent. At times they get violent.
And the violent when there is withdrawal.
Withdrawals, yes.
We face a lot of problems in coal India. Every other day there is a call in the dead of the night. Because withdrawal, the biggest problem is craving.
So that becomes an issue.
Yeah, definitely. That becomes an issue with the trade union, with public and everyone.
They get abusive.
For those patients, that's why assessment is very important. You have to get a proper history, you get a proper physical examination, because there are comorbid conditions. Most of these people may be having diabetes, maybe
hypertension,
heart disease, and other are very common because it may cause cardiomyopathy, dilatation of the heart. There may be ventricular tachycardia. A lot of things are involved in it. So proper physical evaluation, and then you go for this. And having done that, I take help of my other colleagues in evaluation of the things. And then you go for a one-to-one interview of the family that we are planning this. You have to leave. You may face these problems. And most of the people have already tried it, so they don't know it. And we are going to tackle with medicines. And then we will continue with this. The problem is that with the advent of TV after 11 p.m., those things are there. Most of them are not scientific. And how I came to know, because my patients only told me, they have got the medicines, they are costly, but they are not very useful.
Useful, okay.
But most of the cases can be done in our OPD settings. Those who are having very strong withdrawal, only they should be put inside. Means they should be institutional treatment.
So I think we had a very nice session with Dr. Chakravarti. It is very strongly said that you consume alcohol, but alcohol should not start consuming your health. That is very important. And what sir said today was very pertinent, that it's the family who has to stand by and you have to understand that you want to leave alcohol and come back to a normal family life. There are a lot of families which in the hospital, sir will also vouch, that we have seen they have got ruined because of alcohol, and young children have been affected by this. So we can treat you, and we have the facility, and I think consultants like sir, like Dr. Chakravarti can help you. So we will come back for Kalinga's Med Talk again. Please tune in with us, stay with us. For any query, for any appointment, you can always contact Kalinga Hospital. Namaskar.